Welcome to Coffee and Community, Cutaneous Lymphoma Conversations, brought to you by the Cutaneous Lymphoma Foundation. I'm today's host, Holly Preeb. Joining me today is Scott, a member of the Cutaneous Lymphoma community. It's such an honor to spend time with someone willing to share their stories to help the next person. So grab your favorite cup of coffee, settle in as Scott and I discuss his journey with cutaneous lymphoma. Welcome, Scott. Thanks so much for joining us today.
Yeah, thanks for having me. Glad to be here.
So I think we need to set the stage, right? We need to start at the beginning and really allow you to dive in and share your story in its entirety. And then we can dive in and answer some more questions from there.
Yeah, sounds good. I don't know if anyone's had like a standard journey with this, so I'm not sure. There's so few people with this. So my journey, I guess I would describe as fairly weird. My background, I've had several like skin moles that have been removed for general skin cancer prevention. Nothing that's been cancerous, all benign. So I've had like this general, I guess, fear of cancer, or I've been aware of cancer kind of in conversations with my providers. But in April of 24, I was diagnosed with primary cutaneous anaplastic large cell lymphoma, one of the, I guess, more rare variants of cutaneous lymphoma. And my journey since being diagnosed has kind of been met with, when I explain it to people, tell them that it's a type of skin based lymphoma. And I think a lot of people think it's a skin cancer, and they say, "Oh yeah, my dad had a mole that was removed and he was fine, so you'll be fine too." And so that's kind of been what I've been met with. So the weirder part of my journey is kind of getting people to understand it. It took me a long time to understand it, but so I wouldn't expect everyone to understand it instantly. But there's I think a constant amount of stress involved in kind of understanding and living with this kind of diagnosis and understanding when it's going to pop up next, if it's going to pop up. So that's kind of been the basis, weird general anxiety around this journey. I feel confident in it now, but it's always something in the back of your mind.
Yeah, I certainly can appreciate that. I mean, it's from diagnosis into probably to where you are present date, you've had a bit of a roller coaster. I think you and I have chatted a little bit about reoccurrences and things of that nature. So there's some uniqueness maybe there for you that others may or may not experience. Chat with me a little bit about and help us understand kind of that part of your journey early on and to present date.
So the I think it was March of 2024. I noticed a small bump on my arm and didn't think anything of it. Thought it was a bug bite at the time, and um, after about a week, it wasn't gone, and I wasn't paying attention to it. I had tattoos, so it's kind of hard to see the specifics of the bump kind of progressing. But after 2 to 3 weeks, I significantly noticed that it was quite a bit bigger, about the size of a quarter. Definitely not bug bite size anymore. And had an appointment with my normal dermatologist. They did a normal biopsy on it. And my normal skin biopsies that I've had, I haven't had a ton, but come back in 2 to 3 days. My mom's had a ton. And so she's had a very short turnaround on biopsy. And that's what I was expecting. Get it cut off on a Wednesday, get the answer on Friday that it's fine. And that was kind of my expectation. And 2 weeks went by and I hadn't heard anything from my dermatologist. I reached out, twice during that 2 week period. And finally I get a call. I remember the exact moment. I was driving home. I was talking to my dad on the phone, and um, I get the call. And so I'm like, "Oh, Dad, I'll call you back." And it's my dermatologist. And I'm at a stoplight and I'm kind of not paying attention. I'm expecting her to say that it's totally fine and it's just a benign thing. And um, she asks, if I have several minutes to talk. And so I didn't know what that, was leading to. But she then said that it came back positive for CD30 positive lymphoproliferate disorder. It took me a while to kind of understand, never heard that one before. And then she, clearly said this is a type of lymphoma. And I was blown away. I'd never even heard of a skin, bump turning into lymphoma. And I thought that was always like a bump under your armpit. And so I was completely just, kind of unaware of this type of condition. So she continues to explain that while it is positive for that condition, it's a spectrum of conditions. And the spectrum that she outlined for me was, could be lymphomatoid papulosis, kind of the most benign, easy to manage, but recurrent condition. It could be primary cutaneous anaplastic large cell lymphoma or this more aggressive systemic anaplastic large cell lymphoma. And so she suggested that I reach out to the oncology department. She put in a referral, and I had no clue what was going on. She finished the conversation with, based on everything we've seen, it's hard to, from the pathology, land on exactly one of those because they all look so similar. But her research and conferring with colleagues landed on primary cutaneous anaplastic large cell lymphoma, or PCALCL, and sent me some materials to kind of read up on. Maybe it was normal WebMD stuff. Met with the oncologist and had probably a 1 week wait to meet with the oncology team, which felt like 2 years, to actually get into meeting with someone. And as I mentioned, cancer has always been something back of mind. It's something that I'm never looking forward to. And this is, it's pretty shocking. My wife had a breast cancer scare when our son was 1 year old, and she ended up being fine. And so she was used to she was more familiar getting this type of call. But she was really solid in kind of reassuring me that, we get through this and manage it. And so that was nice to have that kind of source, constant cheering at home. But every time I Googled, there's not a lot of information out there about this. And so I didn't have a constant source, didn't know if there was any sort of sources that I could trust more than others, and ended up meeting with the oncologist. And he had mentioned that this is the first case that he'd seen of this condition. And so while he felt confident with, the colleagues that he conferred with to land on the diagnosis, you know, treatment was straightforward, but the understanding of the entire condition and how it's going to affect your life was unknown from him because he didn't have this kind of he didn't have a bunch of cases for this. So I ended up having the lesion, which between biopsy and finally removing it was about a 6 week period. And it had grown to maybe 3 inches long, pretty gross looking. I had to have it covered with kind of a band-aid and gauze at all times so no one would, you know, get frightened in public. And so we ended up having it surgically removed and met with radiation to kind of make sure it was gone. And it was, I had no recurrences after that. We met with follow up with, this is just my local health plan. And they said, 50% of cases come back, 50% never have another recurrence is kind of the stats that I was getting. So I'm a stats major, so not necessarily reassuring that 50-50, it's going to come back and you have to always worry about this or you're one and done. But I went several months without any more recurrences. This was now into summer of 2024, and finally got enough of it in kind of the rear view mirror to think like, oh, maybe I'm part of that 50% that's not going to have recurrences, and things started getting better. And then no clue what caused it, but found another bump on the back of my leg this time. So not in the same spot, it hurt in a different spot. And within 2 days, it was the size of a quarter. Looked similar, painless. My first one was very painful. The new one was completely painless. And, I live in San Diego. It's summer. There's mosquitoes in, various places. And so I'm in this weird spot where I get a mosquito bite. And now I'm not sure if it's going to evolve into a 3 inch, lesion or if it's going to just disappear and it actually is a mosquito bite. So that's probably my biggest challenge that I'm facing ongoing right now. But met back with the same physician that diagnosed it, and he was under the impression that we needed to kind of get on something to treat this because it's clearly not a one and done situation. And, we discussed certain medications that we could go on to try to dampen the immune system, to try to kind of calm it down. And we ended up excising this one as well. So got this one out, radiation again, and kind of playing whack-a-mole, getting these things out of here is kind of the process that we're taking. I don't want to have 100 scars on me, so kind of wanted another process as to how we can take this forward. At that point, where I was thinking that this was done for good, and then one comes back, I kind of had to tell myself, you need to learn more about this, or you need to handle this. This is going to be the rest of your life. Learn about it, know how to handle it. Don't just ignore it. Uh, Started doing more Googling against, kind of my wife's direction, because Googling usually medical things usually never ends well. And so I I think I started searching for images, and it ended up on YouTube of people kind of discussing what theirs looked like, and I was trying to make comparisons, and um, a little video popped up in the corner of the other videos you may like, and I saw that the author was the Cutaneous Lymphoma Foundation, and so navigated to the channel, saw that there was treasure trove of videos for every possible condition. I had no clue that there were other conditions within the cutaneous lymphoma umbrella. And I think it was 2 weeks straight where I would take a walk in the morning and listen to a video on mycosis fungoides, and in the evening just learn about everything. And my physician was unaware of the Cutaneous Lymphoma Foundation, and so I'm glad I stumbled onto it. And in one of the videos, talked specifically about the kind of progression of PCALCL. And there was a physician in that video that was at a center of excellence, a specialist specific to this condition. And she was located within 2 hours from me. So I called up out of the blue to that specialist hospital, and ended up getting an appointment within 3 weeks to be seen, and got unbelievable confidence from that physician and meeting with the specialist, seeing these cases. She wrote a book on these cases. And so her demeanor going, oh, yeah, seen this before. We know what to do. This is what we're going to put you on. This is what we're going to monitor. This is what we're going to look for. Um, this is how we're doing biopsies from now on. And just that level of confidence just was a wave of relief in terms of how I managed and treated the condition. Long drive up to Los Angeles to meet with the physician, but worth it. And then I went the next 8 months with maybe one or two recurrences, minor ones that were treated very quickly. And I've been pretty much in the last maybe 4 or 5 months, I haven't had any recurrence, knock on wood. But in a
Absolutely.
good spot right now, and confident that when the next one comes back, we'll treat it and keep dealing with it. So that's kind of my whole background story.
No, that's great. I'm definitely glad that you found us as well. Sorry that you didn't find us earlier on in your journey, but most importantly, that it actually led you to getting to an expert who could really help you manage what you're working through. You mentioned, obviously a few times that you've got a pretty special wife, but you also mentioned you've got kids as well. Talk to me about that. I mean, obviously, I imagine that you're working, you've got a family, I'm assuming younger kids. How do we balance this, right? How are we balancing the um, I'm in my own space trying to deal with something that just keeps reoccurring. I'm dealing with my own stress, but I've got a family to worry about as well.
Sure. Yeah, probably the hardest part. 38, married, 3 kids. I have a son and 2 daughters, age 7, 5, and 2. At the time of diagnosis, my 2-year-old was 5 months old. So it definitely is I don't think there's any ever a good time to get a diagnosis like this, but certainly that is front of mind when you get a diagnosis that has, the potential to be life threatening at some point. So they're too young to kind of understand the word cancer. They've probably heard it before in passing on a TV show or something. My son can read now, so my wife and I can't do the thing where we spell the word over their heads and try to get it past him. He knows what we're saying, and my daughter's catching on pretty good. But um, so we don't talk about it directly. I've used the word lymphoma a few times around them, and it goes right over their head, luckily, to where they don't really kind of understand the process. Um,
Mhm.
but I certainly have talked about to my wife, hey, I found a new bump. I got a new bump on my leg. There's a new bump on my arm. Um, and my daughter, my middle daughter, who's 5 now, she got a bug bite a couple weekends ago. And she said, hey, Dad, I've got one of the bumps just like you got. Do I need to go to the doctor? And so it
Yeah.
was kind of, they absorb a lot more than you think, but cute and at the same time sad. She doesn't know what's going on. So it certainly was a challenge. The biggest thing going through my mind in the initial days, the diagnosis is, what, my kid's going to have a parent, going forward and that sort of stuff. You go to the darkest part, which is certainly a challenge. But, I've gotten to the point where I've gotten really confident in the diagnosis, the meeting groups that I've had with the foundation, seeing people that are well into their 80s with this condition, super encouraging. All the amount of treatments that you have. It's crazy to think that it's not just one treatment. There's countless medications, there's surgeries, there's radiation, there's fusions. It's just really encouraging to know all the options you have going forward. So I've gotten really confident and at the same time, just it sounds weird, but kind of grateful that I have this kind of looming thing that helps me appreciate the kids even more than I already did, on a day-to-day basis. So tried to be as positive as I could, but yeah, certainly is a challenge managing it with them. You're thinking about them all the time and trying to keep them out of the specifics. I keep a journal that I'll give to them when they're 18 and they can understand it and they'll be able to read about, how it happened. I hopefully they don't have to worry about this. I hope.
Yeah, I can certainly appreciate that. So, I imagine, and over the course of a lot of these conversations, right? I'm sure some of them were your biggest challenges. Are there standout moments that you would say so far in your journey that have been your biggest challenges during your diagnosis, or something beyond, just the day to day, or just, I suppose navigating, finding the right physicians and information, but something that's kind of that standout thing that, boy, if I could solve this for the next person, boy, wouldn't I?
Yeah, it's a good question. I think finding the specialist was one of the biggest areas of relief that I came in this kind of diagnosis and journey and kind of prognosis going forward. I had never had a condition that needed a specialist before, other than, go to your primary care. And if you have a vision thing, they send you to an eye doctor. And I guess there was this kind of misconception that I had that physicians might refer you to the specialist out of state that you could go see. I understand that's an unpractical or impractical thing that they might not recommend, but finding your own physician, doing your own searching, getting involved with the community. I see on the Facebook group all the time of people saying, "Has anyone found a specialist in Minnesota?" And three people will respond of, "Yeah, I went to this person and they're great." And um, so taking your own kind of time to find the specialist was a huge. I never planned it, but just kind of forced into it, I guess, to try to find that. Um, and then it's hard. The hardest thing is being patient, waiting for a scan. I've had several PET CT scans done, waiting to get the scan, waiting to get results of the scan. Find something to distract yourself has been the biggest challenge, during that waiting period. My kids are a very exhausting, welcome distraction. So that has been my distraction as well. Trying not to just sit there and dwell on it. It's easier said than done.
Yeah, I would say that's definitely a difficult challenge. And you are fortunate. You have a beautiful family to be able to fall back on there. Distraction or not, it's a good
Yes.
place to be. When you think about what would be advice that you'd give somebody who stumbled upon this video, and maybe it's the very first thing they've ever seen or heard about their diagnosis. It's the clip that was recommended, right? The clip that
Yeah.
got recommended
Yeah.
because they were out Googling on something
Yeah.
else. What is that piece of advice for that next person that you hope or wish that they would know?
Yeah. I've been to all the networking groups twice a month, when I can and schedules permit. And we meet a lot of people, a lot of different conditions. And I don't know if there's a nicer way to say this, but it's not a death sentence. It's certainly something that is manageable. You have tiers of options from the least invasive to the most invasive. The specialists that I've been seeing have outlined everything in their toolbox that they can do for this and the confidence they have in each of them. And, kind of the understanding that although it's a 1 in 10 million condition, it's something that people have spent their careers digging into, and they're looking for you. Like they're looking to help you. And so I think staying positive and really understanding that as hard as it is, you'll get through this. No one wants to hear that. It didn't help me at all the first 2 months that I heard it, but once I started to buy into that, It really is, something that you will learn to live with, and you'll live with it. You'll hopefully die with it, not from it, is the other kind of, sometimes it's helpful to hear. Um, so just really understanding that process, that it's treatable, and it's a lot of options.
I would agree with you there. That's a hard one, right? When we hear it early on, a lot of people don't want to feel underscored in their level of worry. So, it's finding the balance and helping people understand, take it one day at a time. We don't need to hit the finish line and be all the way there before we need to be. You mentioned a couple of things that actually struck me. The melanoma, the instant when you talk about skin and you talk about cancer, lymphoma, people instantly go to that. You talked about feeling the need to cover the spot on your arm because of the way that it looked. Are there misconceptions or things about cutaneous lymphoma or your diagnosis that you think are important, that people who maybe aren't somebody who was with a newly diagnosed, but maybe it's somebody who just happens to stumble upon looking to information, and misconceptions that from personal experience you wish more people knew?
Yeah. The skin cancer thing, I'm not expecting people to fully understand. There's I think when people hear you have this diagnosis, 9 times out of 10, the people are not asking you 1,000 prying follow-up questions, to be polite. They're not, trying to learn everything about it, which is understandable. It's a polite thing to do. They're not kind of rip into the person's kind of personal life. But uh, while, my understanding of most, skin cancers that get excised and removed, those are individual spots that have come up. And, if you have a atypical mole that is removed, treated that situation. It's not a condition that is going to continually recur. And, for this, the understanding of it is a lifetime cancer that comes and goes, ebbs and flows. I think that's kind of the biggest misconception is, while you may go 2 years without having any recurrence, or 20 years without any recurrence, I think for most patients who have this condition, at least how I feel about it, is it's always in the back of your mind. The expression, it's cheesy, but like the wolf's always at your door is the,
Mm.
kind of expression that I've heard. Um, and so it's a challenge. It's, I think, more of a mental challenge to, get through this type of, rather than a physical, like some of the more, I guess, aggressive cancers that there are out there. I'm not a clinician, but this is just kind of my thoughts on how I'm dealing with this.
No, and I appreciate that because we talk about the emotional impact of cutaneous lymphoma, and actually in a research study that we participate in every 2 years with one of our alliance partners, the last go around of data suggested that fatigue was the biggest quality of life impact outcome from that. Assume the fatigue is because it's lifetime, right? It is ongoing. It's a constant in the back of your mind. It's not done and then you don't have to think about it anymore. So
Yeah.
it's poignant that you mention, the that impact of living with it for forever. So obviously we asked you to participate in the podcast, and we're so grateful that you agreed to do so. But why is it important to you that you, number one, joined the podcast to share your story? Number two, that you show up for the networking groups, that you're on the Facebook page or group that we have that's a little more monitored than the other pages. But why get involved? Why bother?
I remember how I felt in those first couple months when I did not have the foundation. I'm seeing people pop up on that said, "Hey, I got diagnosed on Tuesday, this week," and instantly found the foundation, which is awesome. And just these support groups have been so encouraging. I didn't know what to expect from going into kind of a cancer support group. I did Google like San Diego cancer support groups when I initially kind of got diagnosed. Didn't know what to expect, but when I found the first, meeting through the foundation, I was I think expect a lot of people crying, people looking, it sounds bad, but looking sick, and everyone's smiling, encouraging. People are chiming into people's stories. Well, it's a community and people are asking how you're doing. And it's great to have just that level of encouragement and understanding. So when I've seen new people join, I'm not a big social media guy, but I will, if someone asks a question of not asking for ever medical advice, but what's happened in your situation, here's what's happening to me. And you can chime in and just say, oh, look, I have that, that's common in my experience. Any way I can kind of help relieve them and say, like, yeah, you'll get through this. I did. If that can help someone, I'm happy to try to help them.
Well, we're very grateful for it. We do find it's people who have been around a while become amazing mentors to the people who are newly diagnosed, and usually it's a great opportunity to give back, but we're really grateful for you and for being member of the community. What did I miss? You've got quite an extraordinary story. You've had a journey. You've kind of had them come and go, been to, general derms, general oncs, moved on, found treatment. I mean, you've had quite a journey in a short amount of time. So,
Yeah.
is there anything that I missed along this way or that we didn't cover that somebody else should know about?
I think being kind of like I'm a passive kind of introverted person, but when it comes to your health, if you're the loudest, squeakiest wheel, when it comes to your health and your health insurance, and you want to get moved up on that scan list, and you want to get moved up on the oncology kind of cancellation list, do it. It helped me. I got at least gave me something to work towards. So I wasn't kind of like sitting on my hands doing nothing in between those kind of waiting phases. And I can't stress it enough about finding a specialist and feeling confident in it. These conditions are so rare. Any of this umbrella cutaneous lymphoma is just so rare. I know a lot of oncologists are super smart at what they do, but getting people to write the book on this sure gives you kind of a really positive outlook on you're in the right spot. If anything does go wrong, you've got someone who's seen this before, knows the next step to do. Couldn't be happier with kind of a care.
Yeah, that's great advice. Definitely being self-advocating. We're
Yeah,
we're here to advocate on behalf of the community and people, the community as a whole, but we strongly support members of the community advocating for themselves whenever necessary, and we're here to help in any way as we can as well. So, I really appreciate you bringing that up. That was an important piece for people to hear. Any other parts of your journey that we've missed?
that about covers it. I'm hoping it's a boring journey from here on out, but that at least summarizes it for the last 2 years or so.
I agree. I hope it's a boring summary from here on out, and then we'll just be calling on you to help support the next people. Wouldn't that be
Perfect.
amazing?
That'd be great.
Scott, we are so grateful for your time today, and it was a delight to have a conversation with you. And I hope that things go swimmingly well from here forward. But this brings us to the close of this episode of Coffee and Community. Hope the audience found this conversation as insightful as I did. And before we go, I'd like to thank you one more time, Scott, for your time and your commitment to the people that we serve, as well as thanking our sponsors and donors, because without their support, programs like these would not be possible. To our audience, remember you can find more episodes, resources, and a full list of our sponsors on our website at www.clfoundation.org. And if you enjoyed today's episode, please consider subscribing, rating, and leaving a review on your favorite podcast platform. Your feedback your feedback helps us reach more listeners and continue bringing valuable conversations to and from the cutaneous lymphoma community. Thank you for joining us today. Until next time, stay informed, stay connected, and take care.